Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
The conclusions drawn only ask more questions, which is kind of what good research is about, right? Getting us thinking, getting us asking more questions.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you.
Hi, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino. This week, we have an intersection of two topics, research and buccal ties, both topics that we may fall short on knowledge in our profession in the tongue tie world, right? So we'll be chatting about a research article that was published by my professional colleagues about buccal ties. First, if you are a professional listening to this podcast during the fourth week of November 2023, you are in luck. It's my birthday week. And on my birthday, every year, I slash the price of my pro course as an act of gratitude to have had another year serving all of you. So get on over to the website and check out the lowest price of the year. It's a great value for 4 LSERPs, 4 recorded modules, bunch of handouts for your patients, treatment plans, assessment, frenotomy, aftercare modules, and an interdisciplinary professional community to learn alongside of. And now we even have a referral list for professionals for networking. So check it out at tonguetieexperts.net/pro course. And as always, the link will be in the show notes. Okay, so the title of the article we're going to be discussing today is The Buccal Frenum, Trends in Diagnosis and Indications for Treatment of Buccal Ties Among 466 Healthcare Professionals. The authors are Richard Baxter, Robin Merkel-Walsh, Lisa Leahy, Chad Knutson, and Sarush Zaghi. Full credit to all of them for this work. The link to the article and all that we chat about will be in the show notes, of course, but you can Google if you're just listening and you want to just Google the article, and I'll put it all in the links. If you're listening on Instagram or Facebook, it'll be in the links there too. So how do I feel about buccal ties? I get this question all the time. So stay tuned for that, as I want to discuss the article first and then give my personal opinion. And I'll explain to you how I handle the issue in my own practice as an IBCLC. So stick around for that. The data for the research included a completed survey, and the survey had responses from a sample of 466 professionals. They came from over 15 countries, and they had various levels of professional affiliations and professional experience. I was one of those who filled out the survey, and it feels really cool to be part of such a groundbreaking research study. And why is this groundbreaking? The conclusions drawn only ask more questions, which is kind of what good research is about, right? Getting us thinking, asking more questions. But I'm proud of this groundbreaking study and call it groundbreaking because it's an important start. I'm proud of my colleagues who have the commitment to begin such a process, as research is needed but difficult, especially in this field. So besides me, who responded? The 466 responses were comprised of the following health professionals: dentists, speech-language pathologists, lactation consultants, registered dental hygienists who specialized in orofacial myofunctional therapy, occupational therapists, body professionals including physical therapists, chiropractors, osteopaths, craniosacral therapists, physicians, midwives, nurse practitioners, and physician assistants. So they were asked the symptoms of buccal ties. And the symptoms of buccal ties that were reported by these professionals included poor latch, labial seal issues, aerophagia leading to gas, reflux, and colic, milk spilling, also known as an anterior loss during feeding, preventing flanging of the lips, fascial tension, poor gape or mouth opening. One of the things that was great about this survey was that there was an open-ended response field that was included. And on that open response field, many respondents noted that it is hard to distinguish between the impact of buccal versus lip and tongue restrictions. And I feel that way too. And that's one of the things that hold me back sometimes from diagnosing and recommending a release of the buccal. If we don't know, how do we know it's from the buccal? So more has to be done then. Others who responded expressed that buccal ties were rarely, if ever, associated with significant symptoms or functional implications. When asked about clinical symptoms of buccal ties in older children not breastfeeding, most noted feeding issues such as food pocketing, difficulty with straw drinking, poor saliva management, and challenges with the prerequisite oral placement skill of lip rounding, impacting the UOW sounds. Many also remarked that they see concerns with dental issues such as difficulty or pain with brushing the teeth, tooth decay, gingival recession, and possibly poor maxillary growth. Some respondents noted issues with lip incompetence, mouth breathing, and facial tension. Many noted that they rarely release buccal ties in children or reported that they did not correlate buccal ties with functional issues. So not everyone who responded thought that buccal tie release was something that should be done or be done often. As we said before, the survey responses were provider opinions based on their own clinical experience, based on conversations with their colleagues, based on social media or non-peer-reviewed websites. And why is this? Because we just don't have a lot of information on buccal ties. There was a very important statement that I want to read that was part of the article, and it says this: while clinical experience is certainly important and forms the basis for future research. More research is needed on this topic to aid clinical decision making. In addition, the group sampled may or may not represent the entire population of providers and likely represent the most enthusiastic ones, right? So, in other words, if you don't think buccal ties are a problem, you're probably not going to answer a survey related to buccal tie treatment. That was a tongue twister. So inside of the article, another interesting fact was a tool for assessment is introduced. And that tool is a mnemonic buccal, Buccal. And I'll tell you what the letters stand for. B is for blanching tissue. U is for uncomfortable to palpate. C is for clinical impact. C for compensation patterns. There's two others, and I didn't copy it. Oh my goodness. It's okay. It's in the article. It's very interesting to have a tool to use to describe it. There's also class 1 mucosal attachment, class 2 gingival attachment, class 3 alveolar ridge attachment. Important to use this type of classification systems when you're communicating with other providers and also for further research, right? So at the conclusion of the study, the evaluation of the buccal frenum to diagnose a buccal tie relies upon visual inspection, palpation, and assessment of oral function. Buccal ties may affect aerophagia and feeding problems in infants, oral hygiene and dental issues, caries or recession in children and adults, speech issues, feeding issues, and fascial concerns. Survey data and clinical experience are summarized to review classification systems, diagnostic evaluation criteria, and treatment recommendations as a foundational cornerstone for future works. So that's the study. Again, I will post the link. Wherever you're watching, you'll be able to find the link. Now, a couple of things. Another link I'm going to post is about the controversy I was talking about. So we have some people who are on social media, a particular person who will remain nameless, who has called out this research as not, I don't know, I won't even say what she said, but she's bad-mouthing the researchers, let's put it that way. She's not being nice. She's not participating. So the research authors, the study authors, have put up a page to answer the criticism of this work and answer their concerns. So I will post that too. I should have said in the beginning, and it's not really clearly said, a buccal tie is a cheek tie. How do I feel about this? I get this all the time. What do you think about buccal ties, Lisa? And I will say that the jury is still out for me if we should be releasing every cheek attachment that we see, every buccal attachment that we see. I am a firm believer in doing less is better. Sometimes it seems to me that there is such tightness in the buccal area, and I'll see the frenum there, and I will put that in my assessment when I am referring to the pediatric dentist for release. Sometimes I say, I'm not sure, see what you think, needs further assessment. Sometimes my query is, see what it will be like after the release of a concurrent lip and tongue tie, right? So perhaps there's tightness or pulling there because of the lip or tongue tie. Now, many of you have also heard me talk about my grandson. Very interestingly, my grandson developed a buccal tie after the release of his tongue and lip. So fascial changes happen, shifts happen, body work is necessary. As always, an individual approach is needed. I am not one of those people that are going to say, if the lip and tongue didn't solve the problems, we're not going to do the frenum and the buccal. Yes, we would do the frenum and the buccal, One of the other aspects of buccal assessment and treatment, which I have noticed in my own experience, again, this is in my own experience with the babies that are in my care, and parents reporting that the release of the buccal tie is not as traumatic. The exercises to keep that healing well are not as traumatic and not as difficult and don't cause as much distress as under the tongue. So sometimes if we're on the fence, it's a kind of, well, it can't hurt really that much to do it. But that's only with symptoms, not because it looks a certain way. I hope that everyone will review this research and let me know what you think. Keep in mind that we need more research. So if you are a clinician with a large population, or you are able to get research going, let's do it. Let's keep going with this, because the more we do, the more we ask, the more questions come up, right? And we want to answer everyone's questions. Now, if you are listening during the last week, or the fourth week in November, the week of my birthday, be sure to check out the show notes and check out the Tongue Tie Experts professional course and the Milk Supply for Professionals course. Both will be on sale for my birthday at the lowest price of the year. It's my half price sale. It's a very exciting time for me because I get to meet more of you after my birthday when you sign up for the course. So thank you so much for being here. Take care.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.